Hi there, and welcome. My name is Jeff Bell, and on behalf of McLean Hospital, I'd like to thank you for joining us for this latest installment of our educational webinar series. Today, we set our sights on a very timely topic, election stress. Are you feeling some of that? A lot of us are. Election Day 2024 is just around the corner, and we're reminded of that constantly. Turn on a TV and we're likely to be bombarded by political ads. Check out our social media feeds, and chances are we'll run across someone's rant about this party or that politician. There is no denying that a lot is at stake, but despite the inherent stress and uncertainty of the season, there are specific and proven ways to maintain our mental well being in the weeks ahead. So let's talk about those strategies. Our guest is someone with a lot of experience helping people navigate stress and other mental health challenges. Mark Longsjo is a licensed independent clinical social worker who serves as a senior director of McLean Southeast, a satellite location of McLean Hospital. His primary area of professional interest is in adult mental health. Mark, thanks so much for being with us today.
Good morning, Jeff. Wonderful to be here.
We are thrilled to have you. I want to establish right away that you and I are not here to talk about the politics of election stress. We won't be delving into partisan issues. Instead, we're going to focus on the mental health pitfalls often presented by elections and how all of us can best navigate them. So let's start with this, Mark. Why is election season so stressful for so many of us?
Well, let's start by saying that it affects all of us. This is a political stress that affects all of us. It's multifaceted. It's complicated. The range of emotions are pretty extreme. So we can go from worry and sadness and despair to outrage and disgust and anger. And national events like elections, they have short-term stress and they have long-term stress. The repercussions are real. And so one of the things that we do, and we'll talk about this a little bit more, is that difference between stress and then anxiety. So I think that one of the reasons that this is particularly difficult for everybody is that it does impact all of us. And in one way or another, it's affecting all of us right now.
And worth pointing out that this is not something that is dependent upon our political affiliation. This impacts everybody on both sides of the aisle, correct?
That's right. That's right. No, it affects all of us, regardless of political affiliation, regardless of motivations and other reasons why we might be so concerned about this. I'd like to believe that we all deeply care about our country. We deeply care about these results. And that's a good quality to have, to be able to feel like we care about this, that we want to make sure that we are involved, however, not too involved.
It seems to me that things become more intense as we go politically in recent times. What is the trend line? Is it just my imagination and the imagination of others, or are we becoming more divided politically in a lot of fronts, and the stress of election season is becoming a little bit more pronounced?
Well, yeah, I think we are becoming more polarized, but part of that is due to just how inundated we are with all of the media. And so there are studies that show that the more extreme some of these views are, the more polarized we get. I like to believe that we have actually more in common. Even here at the hospital, you see fantastic work going on by plenty of people who have different beliefs, different backgrounds. And so I do think that because of social media and all of the extreme views that we see 24 hours a day, 7 days a week, this news cycle is very, very difficult to ingest and digest, that I do believe that we're a little bit more polarized. Now, it's also true that there's some unique aspects of this particular election cycle. You think about two assassination attempts. You talk about a late changing candidate change for one of the parties, some of the debate drama that we see, some of the ongoing legal battles that are going on. So I think that there are some unique qualities to this particular presidential election. However, I think you're right, Jeff. What we're seeing is that there's more and more polarization. And I do think that it's the 24/7 news cycle. It's how we're inundated with all this information. all the time.
I want to ask you about what some might call the echo chamber effect. Oftentimes, people with a political view will follow social media that basically is in line with that political view. Likewise, with the sources that they turn to for their news. Do you sort of get this effect where you're hearing what you want to hear, and that might only further reinforce your viewpoint?
Yes, absolutely. Very good point. I was talking with a colleague just the other day, and he was mentioning to me some research that he had seen recently where it turns out that the more we listen to the news, the more we try to educate ourselves, the more we try to be involved and participate in all of the social media, actually, the less accurate our view is of the opposing candidate. So the echo chamber is real. I do think that it kind of compounds itself, and the more we're subjected to all of this information, the more there are distortions, and the more that we don't necessarily see all of it as clearly as we could. Sometimes, people are recommending, Jeff, that we read our news instead of watching our news. That's been something that I think has been helpful to plenty of us to be able to regulate how we take in this information. And sometimes reading the news is a little bit better than watching the news. All of these images and these scenes, they are very difficult to process. And I think I'd like to remind our audience that our emotional reactions are much faster than our cognitive reactions.
That is interesting. And we're going to talk much more about sort of metering our news consumption. We'll talk about that a little bit later in the webinar as one of our strategies. I want to ask you to give us kind of Stress 101 overview, perhaps broadly how stress impacts us and how it works, both physiologically and psychologically. And then we'll zero in on election stress. But can you give us the big picture of how stress impacts our lives?
Sure. Yeah. Simply put, stress is the reaction to something external. So an external event, a stressful event like the election, or like going off to college, or other external events that impact us, and it tends to be something that is at current, in the moment, and then once that event passes, then the stress tends to subside. Now, what happens, the difference between stress and then anxiety, is that as stress becomes more chronic, then we start seeing things that are more around the umbrella of anxiety. Some of the disorders that we hear about, generalized anxiety, become very real. The chemicals that are involved are adrenaline and cortisol, and those become higher levels, which are not good for us, both mentally and physiologically.
So stress can develop into something beyond what we might call everyday stress. Is that when we start moving into anxiety disorders, for example?
That's exactly right. So in our situation that we're talking about today, you can imagine that our stress that we're feeling right now is something that is an outside external event. And even with political stress, Jeff, I think that what we're going to see is that this has the unfortunate opportunity to last longer than just what we're experiencing now. So, this is the point that I think that we're trying to make, is that, okay, stress actually can be, used in a productive way. If you're stressed about an upcoming exam, well, that motivates you. You want to participate, you want to get involved, you want to study a little bit harder, you want to make sure you're ready for your exam. So in some ways, stress is a motivator. But there is that line that's crossed when the stress becomes more chronic. And as those chemicals become, more pervasive throughout our bodies, you can understand that both mental and physiological issues start coming up for the individual. And that's where we trend a little bit more toward, okay, this is something that is more of a condition. And that's what we refer to more as anxiety.
And Mark, are we able to watch that process in ourselves? What is the level of self-awareness for most of us when it comes to stress and anxiety?
That's right. Well, there are plenty of symptoms that I think we would all, be able to recognize. Losing sleep is certainly a very key element to this. And the racing thoughts and the difficulty with sleep are a key factor to consider, a key warning sign. Also, losing track of our healthy eating habits. It's really important to have regular meals, healthy meals, avoid too much caffeine, avoid alcohol. There are plenty of warning signs that help us to be able to see if after a couple of weeks, I'm still experiencing some of these symptoms, it might be important to check in with somebody, whether it's a loved one or a professional. But yes, Jeff, there's definitely things that we have to watch out for as stress becomes more chronic.
We'll come back to some of these bigger picture issues. I want to zero in a little bit right now, though, on election stress. What are some of the key drivers in terms of raising our stress level around politics, around the election cycle? What comes to mind for you in terms of those drivers?
Right. Well, what first comes to mind, of course, is the social media, and what we see is just scrolling after scrolling and really having a difficult time breaking away from it. So we do want to recommend digital breaks for people as often as possible. Oftentimes we're recommending, okay, if you need to catch up on what's happening, and that's important to do, stay involved, but maybe 30 minutes in the morning, 30 minutes in the evening, really take a break from that, from the social media and all of the 24/7 news cycle. That's very important. The other kind of component to all of this, Jeff, is the relationships that we have with each other. And sometimes there can be some pretty contentious conversations. So when you talk about political stress, it is unique, and there are elements to it that are important to address. So I think that some of what we do every single day to try to make sure that we're respectful, that we're listening, that we're trying to understand, all of that's very important. But there is a chronic stress there that keeps us from being able to, potentially take care of ourselves and make sure we're setting boundaries and parameters on what we need to do for ourselves.
Indeed. And I know that you've got some specific strategies that we're going to break down in just a bit here as well when it comes to navigating those difficult conversations, for example. I want to ask you about uncertainty. That's a word that comes to mind for me a lot with this election cycle. There is a lot that is unknown or uncertain about our political future in this country. Uncertainty is pretty uncomfortable for most of us. Is that a driver of this stress? And if so, what should we know about navigating uncertainty?
Right. Well, yes, of course. I think that recent surveys that I've seen is that the overwhelming majority of American adults are saying that the election stress is significant for them. Now, that means that it is something that is preoccupying their time. It is something that is causing some of the symptoms I was just talking about, difficulty with sleep, difficulty with appetite, and just basic, kind of care for themselves. So yes, this is an important thing to consider, the uncertainty of this, of our nation's future. Of course, that's a huge, significant issue for all of us. Now, it's important to remember that a lot of what we're experiencing is something that is outside of our control. Mm-hmm. So I know we'll get to some of this, but the elements that we need to think about as individuals include what can we control to try to make sure that we're not overwhelmed, because the thought of being uncertain about our nation's future, that is a very significant statement.
Before we get into some specific strategies, let's talk about some of the co-occurring mental health challenges that could exacerbate some of this stress for us. I'm thinking about people, for example, that might be navigating an anxiety disorder or OCD or addiction. What should we know about that?
Sure. I think you're great to bring that up. Thank you. I think that there are some vulnerabilities there. We already talked about anxiety. And under that umbrella, as you mentioned, obsessive compulsive disorder. I talked a little bit about, I mentioned racing thoughts earlier. And so some of the ruminations and obsessive worries, that's going to be a concern for somebody who has a pre-existing condition, somebody who is struggling with symptoms of OCD. Another disorder under the umbrella of anxiety, of course, is PTSD. And I think that a lot of us need to be mindful and considerate of what that means for some people. People who have been through some very difficult experiences, maybe managing that okay, but the political stress now adds another layer to that. I think depression is also a significant group. Those that are having trouble with mood disorders like depression, they can tend to become more isolated, more withdrawn. And we really are noticing that the more we have social connections, the better we're able to manage this stressful time. So I think depression is an area where we want to make sure that we're aware of the vulnerabilities there. And then you mentioned addiction. That this is a really critical time for people to adhere to all of their treatment plans and making sure that people follow the advice of their providers. But it's very, very important to consider the addiction side of it too, where those are just not good coping strategies, and we need to avoid that.
Marcus, one of our goals for this educational webinar series is to weave in as many audience questions as we can. And a lot of questions coming in for you, which is terrific. So let me get to some of these here. A viewer asks, how can someone manage feeling like their life is on hold and that they don't have control, as you mentioned, control over their anxiety surrounding the election? What about this notion of feeling like our lives are on hold until this election cycle is over?
Right. Good question. I think it's important for us to really make sure that we take a look at our values. Sorry about that. It's important to take a look at our personal values. And so it's important to not consider our lives being on hold, but instead really recognizing that we do have a whole set of personal values that we should turn to. Now, in terms of values with the political election time, there's nothing wrong with having the value of enjoying our country, being proud of our country, participating in voting, of course, and even engaging in helping with campaigns. But I do think that there are other values that we could potentially lose sight of if we're too fixated or fused in one value of this political time. So I don't want people to think that they need to put their lives on hold. What might be more important is to make sure we focus on the values that are important: family, friends, work, social gatherings. Those are very, very important at this time, and I appreciate the question. We do have to put ourselves on hold waiting for the results and see what happens. But in terms of our lives and the other values that we hold so dear, I really think it's an important time to make sure that we keep that balance and that we find ourselves continuing to live our lives and enjoying the things that we do enjoy.
Speaking of balance, a question came in. How do we balance the kind of information that we take in and are exposed to? I'm going to take that question to mean the types of news we follow, the types of conversations we have. Suggestions, Mark, for getting that sort of balance in our life in terms of the input that we get?
Well, one thing I mentioned earlier, of course, was regulating that. So I would encourage digital breaks and regulating the input that we have by saying, no, maybe 30 minutes in the morning, 30 minutes in the evening. If you really need to get caught up on the day's events, I would encourage that, making sure that we're not overdoing it. I would also encourage reading materials instead of watching them. But these are all, important things to consider when we have the input and the control to be able to regulate that. I also recognize that there are some outlets or social media sites that are going to trigger people more than others. And so I do think that it's important as the consumer, to be able to know, which sites do I want to avoid? Those are the ones that really make me more upset. I'm not interested in viewing that stream as much as I am maybe another point of view. So I think it's important to recognize what outlets are triggering for somebody, and try to avoid those.
Let's take a quick break from the political stress for just a moment here and again pull back the lens and talk broadly about self-care basics, because I'm hearing a theme to what you're sharing today, Mark, and that's we need to take care of ourselves during this highly stressful time. Give us some of the basic do's and don'ts when it comes to taking care of ourselves during stressful times.
Sure. Yeah, thank you. We'd like to make sure that we cover a range of things, but I guess it starts with some of the basics that you would consider. Regular exercise, very important, to manage the adrenaline and the cortisol that is really pumping through our bodies during stressful times. Now, regular exercise probably means 30 minutes a day. And it's okay if you can't, do 30 minutes all at one time. It adds up. So a walk for 5 minutes is actually very, very helpful. Getting outside in nature and just having a walk, breathing some fresh air. These are just really important self-care opportunities that are very easy to do, I hope. I think another area that I mentioned was having a regular, healthy diet. 3 meals a day, making sure you stay hydrated, avoiding caffeine and alcohol. Those are pretty basic self-care concepts. Making sleep a priority. And there's a whole lot of information about sleep hygiene and making sure that we prepare ourselves for a good night's sleep. Really putting away your personal device, turning off the TV with plenty of time to be able to settle down and get a good night's rest. I often encourage people to just try a relaxing activity, something like progressive relaxation, meditation, yoga. These are all really, important considerations for self-care. I think it's okay to also think about ourselves in a way that we don't want to have to put ourselves on hold. So, typical self-care includes setting goals for yourself and making sure that, as the person had asked earlier, how do I, manage this while I'm having to keep myself on hold? Well, one of the ways is to maintain that practice of setting goals for yourself. And outside of this political stress, there are other things that are still going on in our lives. Kind of connected with that is what we want to do for ourselves is to practice gratitude. This is a really important concept in positive psychology, where we want to make sure we're reminding ourselves of the things that are positive in our lives. So sometimes keeping a gratitude journal is a really nice way to effectively use some self-care to manage through this stressful time. And then I would also encourage people to really think about staying connected. So in terms of the social groups that you're in, whether it be spiritual organizations, faith-based organizations, just a group of friends that you always get together with, I think it's really important to maintain these social connections and also, check in on each other. So those are some of my first thoughts about self-care, Jeff. And I think that there are plenty of others that we're all well aware of, and they can be quite individualized, actually. And it's important to practice those. We have weeks of time here where we're going to be under quite a bit of stress. And it's not a bad idea to practice the self-care and make sure you identify things that are already right there in your pocket. Not just one or two, but 3, 4, 5 things that you'd be able to do when you're really feeling stressed.
Let me ask you what is a very general question, and I know the answer is complex, but generally speaking, how do we know if it's time to reach out for some professional help?
Oh, thank you. So generally, what we had talked about earlier in terms of some of the risk signs and warning signs, if those last for 2 weeks or more, that really is a point where you should be thinking about talking to a loved one. You should be thinking about talking to your primary care doctor. You should be reaching out to behavioral health professionals. So, when it becomes difficult to get out of bed in the morning, and it's feeling like you've maybe not been able to get to work, Maybe you've skipped a shower. Maybe you're not going to the gym as much anymore. These are all warning signs. And I think that it's important to recognize that if you have a bad day or two, that's expected. This is a very stressful time. But if that gets prolonged, and if that's a couple of weeks that you've been experiencing that, that's where we start recommending, okay, consider reaching out for help. Start the process of making sure you're checking those symptoms and not having things get worse.
Mark, you mentioned values earlier, and that got me thinking about ACT, acceptance and commitment therapy. Can you talk a little bit about that approach and how it might be helpful in dealing with election stress?
Yep. Thank you, Jeff. Yeah, we do find that acceptance and commitment therapy tends to be a really nice paradigm, a nice way to approach this. Sometimes we think about cognitive behavioral therapy, and that can often be a nice way for people to have really tangible tools to be able to navigate some stress. But some of the hurdles with CBT include, it's always good to think about thoughts and how they impact our behaviors. But there's also the opportunity in CBT to do some reframing of the concerns, maybe challenging some of the distortions, maybe challenging some of the catastrophic thinking. And I think that's where some of the hurdles are, because a lot of this is very real for people. And so we tend to look a little bit more toward acceptance and commitment therapy, because the acceptance part of it is we can accept that this is going to be a difficult time. We can accept that we're filled with uncertainty right now. We can accept that it is stressful. And it's important for us to be able to acknowledge that and then set some eyes on the values. So, thanks for referencing that earlier, because the personal values that we have are really important in this process. So, yes, there is the value of enjoying our country for what it is and the process that we're under. But the more important values for us to talk about now is to really distribute that and think about our own personal values, our family, our friends, our workplace, and make sure that we are distributing that. I think of a visual for you, Jeff, and I've been taking some sips out of my water bottle, but it's a little bit heavy. And sometimes the analogy that comes to mind for me is, if I do hold up this water bottle for the whole time that we're talking, all I'm going to do by the end of this is just focus on my water bottle, and I'm going to start sweating and shaking. So what I can do is I can make the choice to put down the water bottle. I can make the choice to stop and, like we do in what we want to make sure that we're encouraging is that we're not fused to this one particular stress that we're all under right now. We really want to make sure that the other values in our life are being considered, distributed, and practiced.
That's a great analogy. And it also speaks to what you were sharing earlier about focusing on what's in our control. You can put down that water bottle. That's in your control.
That's right.
Yeah. Let me weave in a couple more questions here. How can one maintain relationships when we have different views of the election and the topics? How do you support someone experiencing microaggressions? Getting back at that relationship issue here that you mentioned. Right.
Well, there are two different ways, I think, of looking at this. One is, close relationships where we have family and friends that maybe we don't have the same point of view. And so one of the ways that we want to encourage people to approach this is to recognize that value, that relationship is more important than the opinions that we have. So what we want to do is kind of set some boundaries there, have the opportunity for an open discussion. Sometimes, we all have the family member who might come to Thanksgiving dinner this fall, who may have their own, strong opinion, and it ends up getting very difficult to process and to enjoy Thanksgiving dinner when it always turns into the political fight. And so what we try to recommend is getting ahead of that and making sure that we talk to that family member saying, we really want to include you in our gathering. but it's important that we set some boundaries on this. And I do encourage people to try to think ahead so that you're not faced with kind of the expected happening in live time. So getting ahead of that, talking ahead of time. I think the other way of looking at it is the types of conversations that we get into in our day-to-day lives. And I do encourage people to stop and really listen respectfully to what everybody has to say. Everybody has their own story. Everybody has their own reasons for why they may have their own thoughts about this. And I think it is important to stop and listen and treat each other with kindness and respect. The viewer asks the question about microaggressions, though, and there is a point at which you have to trust your own judgment and your own intuitions. And if it is turning towards something that's more contentious and really isn't going to be a productive conversation, there's no reason why you shouldn't, try to dismiss yourself from that conversation respectfully.
We tend to have a number of clinicians in our audience for this webinar series as well, and we're getting a couple of questions from that group that I want to work into our mix here. For clinicians, how can they manage patients who insist on bringing their political views into the therapy session?
Great question. Well, I think that getting back to the wide the wide view of any of our clients, any of our patients is really important. So we really emphasize treating the whole person. And if a client is just continues to persist that they're going to bring the political conversation to therapy, I think there needs to be a discussion about, well, let's get back to our treatment goals. Let's get back to what we're here and focused on. Maybe in the same way that we talk about regulating our own absorption of the social media, maybe the therapy session also needs to be regulated in a way that, if appropriate, you could cover some of the concerns that the client has about the political season, but that should be only a very, very small part of the session. Now, I do respect that sometimes that can become, you give an inch and there goes a mile. But I do think that it's important to remind ourselves of what is the treatment plan? Why were we actually, doing our work together in the first place? And how do we make sure that we maintain our focus on the progress we want to make?
And Mark, another question from a clinician. How would you work with folks on the psychosis spectrum who might experience some paranoia around elections?
Very good question. Well, we certainly experience that a lot here at the hospital, and we're certainly familiar with those types of symptoms. We do our best to first assess how the person is doing. So I do want to make sure, Jeff, that we think a little bit about risk management as well. So we have to make sure that we evaluate how the patient is doing. What is the setting? Is the paranoia developing into something that presents with any type of risk? Here at the hospital, we're constantly thinking about that. We're constantly assessing our patients about safety issues. And so I would caution anybody to think about that first. After that, the opportunity to really build some trust, build an alliance with that client or patient tends to be the best way to be able to check that for the patient. We want to make sure that they're adhering to all of their treatment recommendations, including medication, and make sure that the patient or client is really ready for that type of a conversation where, with good trust, good alliance, good rapport, there is the opportunity to check that and be able to have a productive conversation about what it means to that person.
I want to talk a bit about how we can support somebody who is struggling with election stress. And one of our viewers asked if you could give some examples for strategies for how adults can best support young people with anxiety. I would imagine that there is a certain age bracket where people who are in their teens, for example, might be taking in all of this election stress for the very first time and not quite sure how to process it. What thoughts would you have for their parents, for example?
That's right. The first step is modeling. I do think that what we're seeing is a lot of emotional reaction and a lot of behavioral reaction. So my first suggestion is that Parents and adults really need to be mature, responsible, and model good behaviors, model the opportunity to really listen. So I would recommend that they make sure parents listen to their kids. Adolescents have a lot of opinions, and it's important for us to help them get out of their phone. There's a lot of just constant scrolling with social media, and they're getting inundated with all of this material too. And it's okay for a parent to say, I get it. I'm also experiencing that. Let's talk about it because it feels overwhelming to me. I bet it feels overwhelming to you. What are your thoughts about it? How do you see this? What's your opinion? I think it's okay to engage the adolescent in that conversation. That's a really important thing. Again, connections, very important.
Let me ask you a very specific question that comes to mind. Oftentimes, with the best of intentions, we as parents might say something like, well, try not to think about it. And of course, that can be a trap. You tell somebody not to think about a pink elephant, and they're going to think about what? A pink elephant. Can you speak to that particular challenge in terms of a better way, perhaps, to help somebody else navigate something that they're fixating on?
Sure. Let's see. I suppose one great way to do that is to just make sure that we have the chance to talk, because there's a lot of racing thoughts and ruminations that occur within our own ears, right? So all of this that's going on internally tends to be something that can build and can fester. And so very, very important for us to be able to talk about all of these issues, have a place to be able to vent, have a place to be able to, emotionally kind of let go of some things in a safe place. So fixating on one topic is never healthy. Being fused with one value is never healthy. And so I would recommend that we, offer each other the chance to be able to talk in a safe space, be able to distribute some of those values like we're talking about, and make sure that we stay balanced, because fixating on one thing is never going to be a healthy approach.
You talked about the importance of having connections, social support. Let's think about an adult, for example, who might be challenged by the fact that typically he or she would turn to family members for that kind of support, and perhaps the family disagrees on some of these charged political issues. Suggestions for where that individual might turn for some additional support that might be more helpful or more comfortable or feel safer?
Sure. Yeah, that's a good example. It does happen. It happens quite frequently that an individual might turn to family for support. And actually, what I'm recommending from our webinar here is to say, yeah, reach out to loved ones. Well, that's not always the case for a lot of people in our society. Reaching out to family sometimes can be a trigger. It sometimes can be a very difficult space for them. So it is important to identify other organizations for support. And like-minded areas are really important. Like-minded communities, like-minded people tend to be really important for people to feel accepted and to feel like they're part of a group. So it doesn't have to be political affiliation, although that might help in this instance. This example might be, maybe you offer to volunteer for a campaign that you support. But maybe more important than that is broadening your scope, broadening your community. Again, maybe it's a faith-based community. Maybe it is a group of parents at the school. Maybe it's part of another area of friends that you have maybe disconnected with for a little while. I would really encourage people to find those social connections, and there are plenty of opportunities out there to join organizations. And the social connectedness is a really important part of managing this stress.
A great question just came in that I want to share with you right now. Can you offer suggestions on how to cope after the election for people whose candidate did not win?
Yes. So, well, again, it's very, very important that we respect the process and that we do our best to understand that this is a democracy, and the coping that needs to occur is really being able to civilly, have conversations and respect other people's opinions, and together move forward as a group of people that is respectful of one another. Now, again, talking about being able to avoid certain circumstances, that's really important. If you know that you're going to be triggered by an event, or you're going to be triggered by, a gathering or a picnic or, Thanksgiving dinner, you may want to choose this time to avoid that and maybe pick something else that's going to be more enjoyable while that other event is going on. It's very individualized, Jeff, but I do think that the question is a good one. What if the candidate that I support doesn't win? It's really important for me to have a plan on how I'm going to be able to manage that, keep my balance, make sure that I'm moving forward with what I need to do to take care of myself without being either fixated on all of that stress or maybe even subjected to more triggers that are not going to be helpful to me at all.
It dawns on me that it might be helpful to look at a hypothetical situation. We've talked about a lot of abstract concepts, approaches, and so forth. But if you're comfortable with this, let's just take a hypothetical. Let's call Joe somebody who's struggling right now with anxiety around the election, and perhaps Joe just feels out of sync with much of the country because we are very polarized, and he might feel like he just doesn't fit in because of the election positions that he has. How might you work with Joe using ACT, for example, to help him navigate some of the stress that he's feeling around feeling left out or out of sync with the country because of his political views?
Sure. Well, we talked about how individualized some of this could be. So for Joe, the individual, we want to make this as person-centered as we can for him. And the conversations would be something around, what are some of your other interests? Prior to all of this stress coming on, what were some of the things that you were enjoying in your life? And how do we get back to those? So for Joe, that's going to be, his own story. That's going to be his own way of describing, what he's missing now in his life. And creating a strategy, working with him to find ways to make sure he gets that back into his life. It may not happen overnight, but really focusing on some of the values that are true to him and how to return to those if he's lost sight of some of that.
Question came in from a viewer about what teachers can do to help kids navigate some of this. We touched on it from the parent standpoint, but I'm curious if any thoughts come to mind for you in terms of the education system itself. I'm thinking about the classroom environment where you're teaching civics, for example, or you're teaching history. Some of these topics are going to come up and the uglier side of politics. What might you like to see the education system do to proactively address some of the stress that could be created by those conversations?
Good question. I think that that's a great opportunity for us to deliver that in schools. Teachers have so much influence, and a lot of them are well regarded and respected by their students, and it becomes a real source of influence for the kids and the adolescents. So I would encourage some open dialogue, some conversation, particularly in a civics class where that's already the topic. I would imagine that that's a really great venue for conversations to occur where opinions can be shared in a safe way and facilitated by the teacher in a way that hopefully models what we want for our whole country. So I would say it's a little bit of a microcosm of kind of what can occur in the classroom could be a really good modeling opportunity for the kids. I think that that's a great opportunity. I think the other, if it's not a civics classroom, then I would recommend that maybe the approach should be something a little bit more careful. We certainly don't want to take up a whole biology class on the stress of the election, but it's also okay for a teacher who has a really nice relationship with a student to be able to say, hey, if you are upset about something, I'm here for you. I don't mind talking to you about, politics. If that's something I've kind of noticed that you've been upset about it. I do appreciate that the responsible adults in our world have, an opportunity here to make sure that we're supporting our kids, that we're supporting one another. And I think that there's great opportunity there for us, not only in the classroom, but one to one. These are important. These are important relationships.
We are getting so many great questions coming in. Our audience is always so insightful in what they ask. Are there neutral words that we can use to respectfully disagree? I love that precision of language. What comes to mind for you?
Hmm. I think words like respect, openness. I value our relationship. I would not want anything to change with our relationship because of something that neither one of us can control. I do think that those are the types of words that come to mind for me first, is to, you know, instead of words like contentious or escalating or hostility or vitriol, I would much rather lean toward we have more in common than we think. And there's a place where we can meet in the middle on this. Again, we see it all day. There are productive groups, creating great things, doing great work here at McLean Hospital, for example, right? I talked about it earlier. So I think there's a really important message that we need to send to each other, that we respect one another. Despite our differing opinions, we can still come together and make sure that we're acting appropriately, we're respecting one another, and treating each other as human beings.
Let me ask you about the sometimes, well, this will sometimes happen there, where there is a disconnect between emotion and intellect. Where intellectually we completely understand that it makes no sense to get into an argument with Uncle Steve about politics because we know we're going to get sucked into it. It's going to be contentious and yada, yada. But then Uncle Steve says something at the dinner table that really sets us off. And emotionally, we've got steam coming out of our ears and it seems like we can't help ourselves but engage. Advice for that moment, Mark. How do we get emotion out of the way of what we might intellectually understand?
Right. Yeah. The emotional reaction is much faster than the cognitive reaction. So, to the best of our ability, you got to look before you leap, right? So, Uncle Steve starts getting into a really, difficult topic, and there you are at the table, and you're in the moment. And I think that the most important thing for us to be able to do is respectfully, say this is not the time or the place. If appropriate, we could have a conversation about this, but we need to set some guidelines on how we're going to have this conversation. So in that moment, my opinion is it's perfectly fine to leave the situation because there's really nothing productive that's going to come from that. It may be difficult, and Uncle Steve or whoever, might, take offense to that. But my opinion is that we're all under a lot of stress. This is very serious, actually, to be able to talk about this in this webinar, to be able to understand the importance of taking care of ourselves during this time. We really don't want to subject ourselves to that type of high level stress. And you can understand how the cortisol and the adrenaline starts to pump. And it's a little bit hard to reverse the engines when all of that starts bubbling up. But I do want to encourage all of us to anticipate that these things could happen. Sometimes these events don't just come out of the blue. And it's important to anticipate, well, if this doesn't go well, and I start feeling myself going up in terms of my anxiety and my stress, I think it's really important to recognize that, identify it, and back away, dismiss yourself from that conversation.
I'm going to put you on the spot with a very specific question about that. Let me be Uncle Steve for a moment. I'd like to have you respond in a way that might be helpful to help diffuse the tension and even dismiss yourself from the conversation. But I'm Uncle Steve at the table, and I say something like, "Did you see what that other idiot on the other side had to say today? Can you believe that he or she is going to get us in all kinds of trouble and so forth?" How do you diffuse that situation? What might you say to Uncle Steve to just either back out or bring down the tension?
Well, Steve, remember this is not something that we want to be talking about at the table. I'm happy to talk to you about this some other time, but right now is not a good time for me. I would much rather talk to you at a time that we both can feel like we can manage this and not get ourselves too upset.
Can I borrow you for my next family get together? You make that sound so easy. Yeah.
Well, yeah. So it's not as easy as it sounds, and it has to have some persistence to it. Sorry about that. Um, but I think it's very, very important to keep your cool, stay steady, anticipate. That tends to be the most important part of this, is that you don't want to be caught off guard. And that's when your emotional reactions are just so much faster than your cognitive reactions. So it's very, very important to anticipate these types of contentious, interactions, and be prepared to be able to say, look, I respect you. I respect you. Your opinion is very real, and I understand, your story and where you're coming from, because I'm listening to you. But I don't think this is the right time for us to have this conversation. I don't like how it's making me feel. I'm under a lot of stress, and we're just going to have to stop this conversation now.
Yeah, it sounds like some honesty can go a long way in that situation. Mark, a specific question that came in from a clinician. When is it appropriate for a clinician to suggest medical leave for their patients? When should we have that talk with our patients, especially college students? I'm going to take that to be within the sphere of what we're talking about today. So perhaps that patient is really struggling with election stress, for example. Thoughts?
No, sure. Well, it corresponds, of course, to the symptoms, and so a careful assessment of what's going on with that individual. If you're thinking about a leave of absence, you're talking about some pretty significant symptoms. So that would include, whether it be depression and not being able to get out of bed, a decrease in functioning. Well, if it's a college student, maybe they're just not completing any of their academics and looking at potentially needing to withdraw for the semester. But if it's an employee who hasn't been able to get to work, is really struggling with sleep and performance at work, these are all very real issues. We face it here at the hospital. We deal with a lot of stressful things all day with our work, and you can imagine the impact that it has on employees. So I'm familiar with this. I know that it's important to recognize these symptoms that come up. And so, really serious symptoms of anxiety and depression can include, not being able to function, having some thoughts of self-harm. So these are careful assessments that need to be done, and they need to be considered in a way that not only allows for somebody to take a leave of absence from their current stress, whether it be school or work, but also making sure we integrate some type of a treatment plan. So that might include, going to the hospital for an evaluation. It might include considering a more intensive outpatient program. But these are very, very important things to do when you think about your client going out on a leave. It's really got to include some type of an active treatment plan.
So let me ask you a couple of questions about resources, because under the umbrella of focusing on what we can control, reaching out for help is something we can control, whether that's reading a book, watching a video, or actually seeking professional care. Let me start with the latter of those. If somebody is challenged by the topics that we're talking about today, election stress, and it doesn't feel to them that this is something necessarily bigger than that or a diagnosable disorder, but they want to get some care from a professional for dealing with some of the stress that they're up against right now around the election, where might we point them? How would they go about finding professional help?
Mm-hmm. Well, sometimes it depends on the relationship that the individual has. But I would certainly recommend that somebody go to somebody who's already established in their life. So it might be a good relationship with a primary care physician. It might be a good relationship with a therapist that they already have. It also might be that they know of a family member or a family friend that has been through it before and knows, different resources that they can help them access. Those are all good things. I think reaching out for help is certainly what we're looking for in that type of a situation. In terms of resources and opportunities out there, it is dependent on where you live and what region you're in. I think that telehealth has come a long way, but we do have to consider that there are great organizations out there that are providing very accessible telehealth. what we're doing here on our webinar is a good example of how we're reaching lots of people. And I think that the telehealth has become such an important part of being able to deliver the care that we want to our communities.
And if somebody wants to pick up a book or perhaps watch a video or visit a website, does anything come to mind for you? And even by topic, I mean, you need not identify a particular book, or you're welcome to. But if somebody wants to learn more about ACT, for example, is that something that they can do on their own to at least learn the vocabulary?
Sure. There are a couple of sites that I had looked at as we were preparing for this webinar, and the American Psychological Association, APA, APA.org. Great site with lots of resources. You can learn about different approaches toward care, but also, a great list of self-care resources, different books and videos that would be available for somebody to look at there. I also like turning to the National Institute of Mental Health, NIMH. They had a really nice site there. Caring for your mental health was something that I looked at NIMH. And NAMI, National Association on Mental Illness. That's another great organization that offers some good supports and resources. So those were a few. And then I think, Jeff, I want to make sure that I mention a resource in Massachusetts, and maybe not all of our viewers are here in Massachusetts, but in terms of accessing care here in our state, I just want to remind people that we do have a Massachusetts behavioral health helpline. I'm going to give that number, and maybe our team can make sure that it's posted for everybody. But 833-773-2445. Again, that's the Massachusetts Behavioral Health Helpline, and there are several community behavioral health centers across our state ready to help. I think following McLean Hospital is a good resource. The education outreach team does a fantastic job, and I think that there's a lot of resources available right here with us and our website as well.
Mark, this hour has just flown by. I want to thank you for being our guest today. I vote that we all make use of some of the great suggestions you offered today and take care of ourselves as we navigate this final stretch of election season. Thank you so much, Mark.
Oh, you're welcome. My pleasure. Thank you.
Mark Longstreth. To those of you watching, thank you for your interest in our educational webinar series. We hope you'll come back for our future sessions, and we wish you a wonderful day.